Hi, and welcome back to Dr. KJ's Age to Perfection. Today I'm going to be doing a follow-up to my previous COVID-19 plea. But before I do that, I first wanted to just thank everyone for the past 6+ weeks for your willingness to stay at home, to practice social distancing, because I really feel like it did help us flatten that curve. Our hospital systems weren't overwhelmed, and we were able to manage appropriately and take care of patients. I also like to thank everyone who has donated PPE, masks, surgical gloves, anything that you've done to donate to myself or to the hospitals. Thank you, it's been greatly appreciated. Today I wanted to talk to you about Georgia opening back up. It's opened up a lot of its businesses, hair salons, barbershops, nail salons, the movie theaters. People have been out in line buying shoes in our parks, not socially distanced. Many of them not wearing masks and them just going on as if COVID-19 doesn't exist. I wanted to talk to you about that because some of the calm that I had as we were practicing social distancing, that this is something that we would get through better than what I previously expected, some of that calm has gone away and there's a lot of fear, and I feel scared for our community. Specifically the Black community, because we are being hit the hardest by this disease. So just for instance, in Georgia, 50% of the deaths in Georgia are in the African American community. This isn't just for Georgia, it's other states too. My sister lives in Kansas. The numbers for Kansas, Black residents are 7 times more likely to die from COVID-19 than their white counterparts. Washington, D.C., the rate among Blacks is 6 times higher than the rate in whites. For states like Arkansas, Illinois, Louisiana, New York, Oregon, South Carolina, Blacks are 3 to 4 times more likely to die than their white counterparts. So this is a disease that are hitting us the hardest. There are lots of reasons for that. Some of the reasons, racism. We don't have access to health care, healthy foods, so we have a lot of the predispositions that cause us to become sicker. Also, a lot of African Americans, we work in industries that puts us at risk for contacting the disease. So we are those people on the front lines. We're the ones working in the grocery stores, transportation offices. So we are getting exposed to this virus more than other people. It's really, really important for us to stay at home, for us to continue the social distancing. For those times that you do have to go out, make sure that you are wearing a mask on. Don't take it off. Don't say, oh, I can't breathe. It's hard to breathe. I can't catch my breath. Keep the mask on. It's much easier to breathe with the mask on than if you have COVID and are needing to get intubated. So keep your mask on. Continue to social distance. I want our community to stay safe. I want our community to stay whole, because when people do get COVID-19, it doesn't just usually affect one family member. It's affecting multiple people in the families, and then there's just total devastation. I think the saddest part about this is that when people are dying with COVID-19, they're not dying surrounded by their families and loved ones. They're dying alone, by themselves, without anyone to be by their sides. People are having to use iPads to say goodbye to their family members when they're in the hospital because you can't have a guest come in. What I've been teaching my students and what I've taught my students over the years is that with death and dying, the most important thing that we can do for our patients is to just be there, to hold their hand, to touch their shoulders, to be there for them as they're dying. And we're not able to do that during this. We can't just stay in the room. We can't just hold people's hands. We can't just be with them. So it's really important to just stay at home so you don't have to go through that, to practice social distancing, to try to stay in as much as possible to protect yourself, and not only yourself, but all your loved ones that could potentially get sick too. Thank you for watching.